On Larry King Now, the war on prescription drugs.
It's much easier to go to a doctor and be like, I sprained my ankle, than, lurk around downtown. Some doctors are more inclined to write you a prescription for Vicodin than tell you to go to get Advil.
Reality star and former addict Jack Osbourne and our panel of experts take on the growing problem that's killing thousands of Americans.
So it's this never-ending cycle that basically this merry-go-round that they can't get off of, and all they're spending their day is going, where am I going to get my next fix?
Nowadays, it's not hard to get help. It's hard to get quality help.
And why this problem is bigger than you may think.
You know, you hear so much about Ebola and all these kind of media crisis health issues. 40,000 of our young people are going to die of prescription drug overdose deaths this year. 40,000.
Plus,
young people have the perception that because this is a legal drug or comes from a doctor's office, that it's safer. And we absolutely, as you know that that's absolutely not true.
All next on Larry King Now. Welcome to another edition of Larry King Now. Today, a very important program on addiction. 100 people die from prescription drug overdoses every day in the United States, and death rates from these overdoses have more than tripled since 1990. When you think of the war on drugs, you don't think prescription medication. Today, our panel of experts is here to discuss this important topic. Jack Osbourne was born into a rock and roll family. The reality star and producer has been open about being addicted to painkillers as a child. A few years ago, he was given a life-changing diagnosis when he learned he had multiple sclerosis. Bob Forrest is an addiction specialist, former addict, who appears on VH1's Celebrity Rehab. He's also the director of the Hollywood Recovery Services. And Dr. Damon Raskin is medical director at the famed Cliffside Malibu Treatment Center. He specializes in addiction, detoxification, and other substance abuse problems. All right, gentlemen, we'll start with you, Jack. Why is this so prevalent now? More than 4.9 million people in the United States are non-medical users of pain relievers. In other words, they may have started with a problem, and then they become addicted. Now it's non-medical. Why?
I think, for me, it was because it's readily available. It's much easier to go to a doctor and be like, I sprained my ankle, than, lurk around downtown trying to find a more concentrated, more street form of what the prescription drug is. Opiate is an opiate. And, I think doctors are just more inclined, some doctors are more inclined to write you a prescription for Vicodin than tell you to go to get Advil.
Does it usually start, though, Bob, with an injury of some kind? Does it usually start? I mean, you don't go in one day at 23 years old and say, give me Vicodin.
A lot of times it starts in high school sports injuries. That's where I hear it a lot. Riding bikes, little accidents here, and the exposure clicks with a certain biology. That's what we've all kind of thought about addiction for 80 years. That certain people have an experience when they interface with these drugs that's different than 90% of the population. And so it makes like a mental note, like, this is good. This is really good. And what happens is, as the kid grows up in their 20s, they start having aches and pains, and you see this more and more. And then I always notice, and a lot of my clients will tell you, they know what they want when they sprain their ankle. Mm-hmm. So this is a sophistication that you see.
But, doctor, painkillers are obviously necessary.
Oh, they're
People get accidents, and if 90% need them and 10% go bad, how do you control this since you don't know what 10% will be addicted?
Well, first of all, I want to remove the myth that people actually go out to a doctor seeking pain medications initially. Most of the studies have shown that people will get them from their friends or their family's medicine cabinets, and that's where a lot of these drugs are actually sitting. So you can go to a doctor, and the key is, if you have an injury, you need to tell them, I just want a few. If it's bad pain, just get a few if it's Vicodin or Percocet. Don't get 30, don't get 60. Maybe ask for 10 just as a trial to see if it works. Because that extra, most people, the non-addicts, are going to keep these pills in their medicine cabinets, and so it's easy access for friends or people coming over to the house, and that's where they're getting most of their drugs.
When I was a teenager and go to a friend's house, the first thing I would do, go to their parents' cabinet, open up, and look, see what they had. Every one of my friends did in high school. That's just what you did.
Now, but every one of your friends weren't addicts, right?
No, but we were kids. There were a lot of them were kids just messing around. You know, I was of that unfortunate group that liked the feeling, and my body reacted differently than them, and I decided to continuously pursue that high.
And what is the danger, Bob, in a...
Well, the danger is the death rate that we have in this country. It's unacceptable. I always say, you know, you hear so much about Ebola and all these kind of media crisis health issues. 40,000 of our young people are going to die of prescription drug overdose deaths this year. 40,000.
Yeah.
Is that bigger than cocaine?
Oh, it is. It's absolutely bigger than cocaine.
Vicodin is a bigger problem than heroin.
Oh, absolutely. Well, what happens is people start out...
They're a related problem.
They are related. And see, the thing is that you can start out with Vicodin. In fact, I don't know if you know this, but 99% of the world's Vicodin is here in the United States. So this is a huge problem. And what happens is they may start out with a Vicodin. See, young people have the perception that because this is a legal drug or this comes from a doctor's office, that it's safer. And we absolutely, as you know that that's absolutely not true. But they have that perception that because it is legal that it's okay. But it's absolutely a very, very dangerous problem.
So how do you know if you initially take it for a broken arm or something? How do you know if you're addicted? How do you know?
Well, you know, I think there's different, you know, there's the physical addiction. You know, I'll give you an example. A friend of mine was wounded in the war, and they gave him tons and tons of pain medicine. And he was on them for a year, and he was never a drug addict, whatever. And when he got out of hospital, he's like, I'm not taking these anymore. He nearly went into a seizure. His body completely shut down because physically he was addicted, but mentally he didn't care for it. Whereas me, I had the physical addiction where my body needed it, but then mentally I couldn't cope without it. So it became a crutch. And it was at that point when you have this moment where you're like, wait a second, even if I wanted to get off this, physically I can't. And mentally, I need something.
Did you know you were addicted, Bob?
Yeah, I just knew that something about it was like a magical potion. There's a certain personality characteristics and certain kind of perceptions of life that a teenager has that when you take that magical potion, you're always going to take it. I remember specifically, I was like 14, 15, like, oh, this is how everyone else feels. So if we can educate our kids, in the addict population, we do educate our kids. But listen, you know, there's a 50-50 shot that you're going to have this experience if you smoke some pot, if you take a Vicodin. And I've talked to my older son, he's 28, never been in rehab, never, you know, I'm pretty proud of that. But we had serious conversations at 15, 16. Like, there's a 50-50 shot here that you're going to love this stuff so much, you'll give your life away for it.
What about it medically, doctor, kills you?
Opiates, they work in the central nervous system in the brain, and the problem is that too much will actually stop your respirations, and that's why people will overdose and just stop breathing.
Coming up, how our healthcare system and the government are contributing to the growing problem of prescription drug addiction. Stay with us. We're back with Jack Osbourne, Bob Forrest, and Dr. Damon Raskin. Our subject is prescription drug abuse. We'll touch other areas as well. When you think of the war on drugs, you don't think prescription medication. Is the government partly to blame?
I mean, I think they definitely they contribute to the problem in trying to fix it. I think the outlook is all wrong. You know, you've got pharmaceutical companies lobbying politicians, and you know, all this kind of intertwining of, you know, oh, it's medicine, but it's opiate for the masses at the end of the day.
Did we lose the war on drugs?
Yeah. You know, the newest thing is, I'm born and raised in Los Angeles, right? When I was a kid, if you had to go to the doctor and you got medicine, you went to a thing called the pharmacy. There was one in our area of Los Angeles. Now, there are pharmacies, sometimes 3 to a corner. We are an over-pill-taken nation. And no one notices, like, all these Walgreens, CVS's. It's because we've become immune to coping with any pain, anxiety, as a society, as a whole, with anything other than pills. And we've got to look at ourselves as a nation.
Well, the desire to feel better is a human desire, isn't it, Tom?
Absolutely, and we all want a pill. We don't necessarily want to do much work, you know. That's why everyone's fat in America. We don't necessarily believe in diet and exercise. Everyone wants a pill to fix things. And
Should there be stricter regulations on the healthcare industry?
Well, I think there absolutely should be. I think doctors need more education. I think we need to learn to give patients the least harmful medicine, the smallest quantities for the least amount of time. And we need to be required to look in databases to see if patients are shopping doctors and getting prescriptions from multiple different places.
That you need.
And right now it is available in California, but it's an optional thing. And there's actually a ballot measure on the upcoming ballot in November to require doctors to use that.
A study last month found that states that permit medical marijuana reported a 25% decrease in prescription drug overdoses. You like the legalization of marijuana?
I do. I look at marijuana as being a less harmful, drug than alcohol. You look at deaths associated with alcohol. I mean, even directly or as a result of, it's insane. It's thousands of people a year. Marijuana, granted, it's not as easily accessible as alcohol, but it's much less. Be it there are. It isn't just anyone can have marijuana. It's all good, and there's no long-term side effects. There are, but everything in moderation, I believe.
What do you think about legalization?
I'm more even progressive than that. Look we have a system that doesn't work. We need treatment over incarceration. That's it. When you put a drug addict in prison with a crime element, they're going to come out a drug addict criminal. So if you can get treatment over incarceration, that's what we need at a national level. And if we don't, here's an interesting thing. I work in Nevada a lot of very progressive thinkers out there. They don't want to become California. They don't want to incarcerate 1 million of their population who are on crystal meth, pot, Molly, all these different drugs. So they're very open to different ways of doing things and different ways of dealing with crime.
What do you think?
Drugs.
Well, I also agree that it shouldn't be criminalized, but I think that legalizing marijuana actually makes it seem much more acceptable to our young people in our society. And we absolutely have the science behind knowing that younger people, the sooner they start marijuana, it can actually change their developing brains. Because your brain is not fully developed till around the age of 25 or 26. And we've seen studies showing that if you start using marijuana regularly, 13, 14, 15 years old, which is what we see commonly, you have lower IQs, and brains that actually look more like schizophrenic brains later on in life.
Isn't alcohol worse?
I think alcohol is just as bad, but we should make something else okay because alcohol is bad.
Now, the federal government recently put hydrocodone in a more restrictive category, making it more difficult to prescribe. You agree?
Yeah, but it's not gonna stop
Still
it.
pretty easy to get.
Yeah.
And what, doctors can no longer phone it in can't call it in? Is that it? You have to write the prescription? Is that going to help?
What's going on with the patient population I'm dealing with is they go to urgent cares a lot. Urgent cares, we have, probably 1,000 urgent cares in Southern California, which were alternatives because nobody had health care and all that. So things are changing, yet these urgent cares, that's where the kids go.
Are there stronger moves we can make to restrict the use of prescription drugs?
I think, like I said, requiring doctors to really be educated by taking courses, by being certified and understanding how to use these prescriptions. That's going to be important. Going into these databases to find out where patients are getting their medicines and how many and what they're doing, that's important. But just by changing the regulation, by saying you can't call in the prescription, that's not going to do much. What I see, especially at Cliffside Malibu, is that patients may not get these Vicodins and Percocets and prescription pain pills. After a while, they get to be expensive. They're hard to find. Then they'll start switching over to heroin. That's why we're seeing increasing use of heroin in places where you never used to see it, in the
Heroin's
suburbs.
less expensive?
It is, much less expensive. You can buy a Percocet on the street for $10, whereas you can buy a $5 little bag of heroin and get way more high than one pill, because you can't just get high. These addicts, don't just get high with one Percocet or one Vicodin. They take 10, 15, 20 pills at a time.
Yeah, and it gets to that critical mass and they get red lighted at the pharmacy. Buy the thing that we've instituted to try to identify them, to help them. It stops them from being able to get multiple prescriptions that they need, or they're going to be sick.
That will then
they turn to the street.
Next, we'll discuss treatment options for those struggling with addictions. Don't go away.
I got to a certain point in my life where I was sort of stagnant in my career. Nothing was going on. I didn't like the way I looked. And so I was seeing a therapist. She said to me one day, "Why don't you just stop today?" And I don't know, just a light went off. I was like, yeah, why don't I? So I did, and...
But you have an addictive personality.
Of course. Yeah, absolutely. Yeah. Well, a lot of comics do.
Yeah,
a lot of comics are either drinking or in recovery. Not all of them, but a lot of them.
That was Chris Hardwick talking about his alcohol addiction. Why is substance abuse more prevalent in Hollywood, or isn't it?
Well, I think there's a lot of pressure on these people, and people also say yes to people in Hollywood a lot. They don't want to confront them and say no. They want to keep their jobs. They want everyone to be happy. So I think people also kind of take medication, substances and whatnot to feel better when they don't have jobs, when they're looking, when they don't get the approval from other people. They're always looking for that approval. I think there's a lot of pressure there.
Do you think there was the child of celebrity put pressure on you?
No, but I think it opened up more opportunities to encounter drugs and alcohol and be in scenarios where it was readily available.
Did your parents know about it?
Oh, absolutely. I mean, my dad had been in and out of rehab since before I was born, so it was always...
You were born to be addicted?
I think I was born with a predisposition to have some kind of addictive gene. You know, I'm not a doctor, but you know, I have addictive behavior even now that I don't drink or do drugs.
How did you stop?
Trouble, long years of trouble. And similar to that thing, I just realized it's the drugs. It's not this, that, or the other thing that you get into the blame game and all that kind of rationalizing. I could see very clearly, and it's called a moment of clarity, it's the drugs. And I picked up myself from there and just walked forward with a lot of help from a lot of people I already knew.
Is it hard for addicts to get help?
Nowadays, it's not hard to get help. It's hard to get quality help.
How do you know? Like, how do I know that your place is better than that place, or is it good?
Well, I think...
How do I know?
I think, you know, you have to do your research. You need to talk to people, and sometimes it's helpful to talk to other patients or clients who have been there, or get word of mouth, or talk to if you have a therapist, get your referral from a therapist, someone that you trust.
How does rehab work?
Well, that's a good question. I think, first of all, the most important thing on my part is to get the patient comfortable and get the substance out of their system in the most comfortable way. And a lot of people are afraid. They won't even start thinking about rehab because they're so concerned that they're going to be so sick from coming off the drugs. And I can reassure you that there are ways now, there are medications and things that we do to help that happen. So once we get them detoxed, then the hard work starts, because that's actually not the hard part. The hard part is really delving into the issues, the psychological issues, and getting a good relationship with the therapist to uncover how to then go forward and live a life clean and sober that's productive.
How effective are treatment programs, Bob?
Some are excellent. You know, I believe it's all based on attachment, right? I think that's what the 12-step model is based on. That's what the rehab, when it's done at its best. It's the people who are presenting themselves to allow the addict to feel comfortable and enter a frame of conversation.
Did multiple sclerosis get you off drugs?
No, I'd been sober 9 years at that point. But it definitely made me wonder, like, could that maybe something that I did cause it? But
do you think there's any...
There's no evidence really proving that drug use. They used to think that cocaine use, especially in the 90s, when doctors started diagnosing multiple sclerosis more, they thought that there was a correlation. But
you think you were a child actor, right?
Yes, I grew up in this business and saw a lot of it growing up, yes.
Is there more of an attempt or more of an attraction to those in the acting category, the comedic category, to be attracted to drugs?
I think so.
Why?
I think you're looking for that next high. Sometimes you get high just because you got a job or you get to interact with fun people and you get that approval. But sometimes when you're hitting your lows and you're looking for other things, then you want to replace that dopamine. That's the neurochemical that releases pleasure and makes us feel good about ourselves. So when we don't have that external part and we don't feel good about ourselves, we look towards substances to try to feel better.
How difficult was withdrawal, Jack?
it was difficult. You know, I have this a weird concept about withdrawal and coming off drugs.
What do you mean weird?
Well, I don't necessarily. I know what you were saying about make people feel comfortable, but for me, you know, I'm a dumb caveman. Like, if I need to know that the fire hurts, so I don't touch it again. So, you know, it was uncomfortable for me. I was young, so they couldn't exactly give me the adult drugs that they give people, the detox drugs. So it was uncomfortable and painful for me. And that's something that I remember. And another reason, I'm like, I don't want to experience that again, because it sucked.
It was a good thing for you.
It was a good thing for me, you know.
Why did the war on drugs fail?
Was aimed the wrong direction, I think. I think, you know, drugs are just, I have a lot of clients that former drug dealers, right? It's just supply and demand. This one drug dealer told me, we're just like Walmart. If people didn't want it, there would be no industry of it. And I started looking at it from his perspective, and that's really how he saw it. And I thought, we're in the business of reducing demand. That's what we got. That's what the war on drugs should be focused on, reducing demand. Before there was Just Say No for his generation, there was the sheriff came into your high school and had a billboard with all the drugs on it. I remember being 14 and thinking, like, I've never seen that before. I want to get some of that.
Do you remember, Larry, the commercials where they used to say, this is your brain, and then they showed a fried egg, and this is your brain on drugs? When they actually went back and looked at that, they found out that all that did was increase the use of eggs, that it actually accelerated, that it made people who use drugs want to eat more eggs and increase cholesterol.
But if you look at it, though, like from a law enforcement standpoint, the war on drugs is the only crime that is profitable for law enforcement, because you get to seize it. You know, if I bust a drug dealer and he's got cars and money and a house, the government goes, well, that's mine now. And now the government has just come up $3 million, $4 million arresting one man. So it's completely skewed in that sense, because there's no real incentive for the U.S. government to go, you know what, we need to cut this off at the source and not at the tail end. What's
the best way to stop all this?
Get into that frame with addicts, one sober addict at a time, just getting in there and starting to try to deal with one individual. I'm saying we can win the war on drugs one addict at a time.
We're talking about how this problem is affecting our kids next.
Was it hard, though? I mean, the beginning, the first few days, coming off it, because it's...
Not when you stop screaming. After that, it's all right. Yeah, it's hard sometimes. It's hard sometimes now, you know.
You want to drink occasionally?
Every now and again, yeah, I want one, sure. Yeah, I don't have it, but every
How do you resist it?
I play the movie on in my head, you know.
You do?
Yeah, it's like, what would happen if I did it?
That was my good friend Craig Ferguson talking about long-time alcohol addiction. Is it true that sometimes drug centers use drugs to get people off drugs?
Oh, absolutely. We do it all the time. And my goal is I always try to get patients off drugs. Sometimes you have to use something to then ease the symptoms so that they stay in treatment. But I find some other places, some other treatment centers, I see people coming that have been on methadone for years and years, or Suboxone, buprenorphine, these drugs, or they're staying on addicting drugs like benzodiazepine, Klonopin, and Valium, and these drugs that can then be more difficult to get off of than the original drug that they were on.
That's a vicious circle.
Absolutely.
It's crazy, especially benzodiazepine. When you hear about all the celebrity death that goes on and it becomes a media sensation for 2 or 3 days, I always know there's going to be benzos involved somewhere. This is thought to be a very benign drug. Every American household has it or something. Nowadays, they can stay on their benzos while they're detoxing off of opiates. And I've never seen such a thing. Just the last 3 to 5 years, I would say. And, you know, you used to be, you go to get off everything, and you can start over if you want.
You still call yourself an addict?
Absolutely. I think, you know, once a cucumber becomes a pickle, it can't become a cucumber again.
Are we having an epidemic of this?
Oh, it's clear cut. We do have an epidemic. We continue to see a rise in prescription drug use. We continue to see a rise in heroin use.
Do we lead the world?
Oh, we definitely lead the world. Like I said, 99% of the Vicodin of the world is right here in the United States.
Do you think depression played a part in your use of drugs?
Absolutely. I think depression is a common trait of most addicts will have.
So you have depression, and they give you drugs for depression, which are often helpful, right?
Yeah. I mean, there are some SSRIs out there which do wonders for the kind of depression I had. But it's...
They don't make you high, though, do they?
No, but they kind of balance you out a little bit.
Isn't that good?
Yeah, it's good, but then when you start throwing in, okay, well now I'm going to start drinking on. I mean, drinking on antidepressants is like, it just nullifies them. It's pointless. And then throw drugs on top of that, and you're just yo-yoing your body.
Is it equally problemsome for men and women?
Oh, absolutely.
Starting to be equal now.
We have some social media questions. Dr. Gonzo has a question for Jack. Is it worth the money to live every day under the public eye with almost no privacy?
I have quite a lot of privacy, so yeah. I mean, you know, people don't know where I live.
Lady Chainsaw tweets, how can I make a loved one see he is destroying his life? What do I do and say? How do I keep from giving up on him?
Get somebody else to help. See, that dance that the codependent and the addict do, it'll never be solved by the codependent. You need help. You need people to come in there and talk with him or her.
Bryson Knox on Facebook asks, what's the worst part of being addicted to prescription drugs?
You know, I think that it's a vicious cycle. People actually don't realize that they continue to use not because they enjoy it anymore. They don't. They continue to use so they don't feel sick. So it's this never-ending cycle that basically this merry-go-round that they can't get off of, and all they're spending their day is going, where am I going to get my next fix? They have no life. And that's the biggest problem with prescription drug use.
Paul Winter on Facebook asks Jack, since sobering up, what's the biggest change you noticed about yourself?
I think the ability to be present. You know, when you've been sober a while, you realize, well, I've never really checked out. I've never gone and got drunk and been like, whoa, I don't even remember what happened. Like, I pretty much remember most things and am aware of everything that's occurred, really.
Thank you all very much.
Thank
Very
you.
enlightening. Thanks to my guests, Jack Osbourne, Bob Forrest, and Dr. Damon Raskin. And remember, you can find me on Twitter @KingsThings.